As of February 2024, we have had half the amount of hospital-acquired pressure injuries as we did for the year in 2023. The most common HAPI or hospital-acquired pressure injury locations are the sacral area and the buttocks. Due to the high rate of pressure injuries within the facility, we have created an algorithm to help provide individualized preventative measures for each patient. These measures will take place at admission and continue throughout their stay. The algorithm is dependent on the patient's Braden score. The Braden score assigns a number to the risk of developing a pressure injury based on the patient's results in 6 categories. If the patient receives a score of 18 or lower, they are considered at risk. To find your patient's Braden score, look in ACIT under Optiview, then click Adult Detailed Assessment. Beneath that, you can click Braden Assessment, and it will come up with the Braden scores for the patient. After determining the patient's Braden score, if they have a score of 18 or below, you will continue the algorithm. If they do not have a score of 18 or below and have a score higher than 18, then no intervention is warranted. If the score is lower than 18, the next question you will ask yourself is this patient continent? If the patient is continent, we will be placing an Optiview on their sacrum. An Optiview dressing is similar to our Optifoam dressings, except an Optiview allows you to view the skin beneath the surface of the dressing. This is beneficial for assessing the skin while the dressing remains in place. On the second day of the admission, OTs often look at the skin. This is a great way for them to see it without having to remove the dressing. Also, as a nurse, during your 24-hour assessments, you can check the skin without having to remove the dressing. If you are applying the dressing, you will be documenting the dressing in Optiview under Adult Detailed Assessment in an Intact Skin Variance group. You will create a group by clicking on the grid beside the title Intact Skin Variance Group. Within that, you will say the area that you've placed the dressing on. Then, for the variance type, you would select Intact Skin. If the patient is continent, you want to assess the skin and see if there's any redness. If there is redness, you will be using the camelseptine cream. If there is no redness, you will use our standard silicone barrier cream. These creams can be found in either your utility room or your medroom. Let's review our algorithm. If a patient has a Braden score of 18 or lower, we are going to see if they are continent. If they are continent, we will place an Optiview clear dressing over their sacral area and document it in ACIT. If they are not continent, we will use a cream. If there is redness present, we will use camelseptine. If there is no redness present, we will use a silicone barrier cream. The creams can be documented as you document continence. These interventions will follow a patient from admission to discharge. They may be modified as needed based on assessments by clinicians. These dressings need to be changed every 72 hours or when soiled. The creams should be changed every time the patient uses the restroom. Ensure that the previous application of cream is removed prior to applying more cream.